Simon at Direct Access Vasectomy, and in this video talking about how to choose a vasectomy clinic in Melbourne. If you've made that definite decision, we're done with fertility, either we've got the kids we want or there's no desire for kids, then a bit of quick Googling will show you've got a few options for touching base with the vasectomy provider in Melbourne. The first thing to think about is technique and why that's important, why it matters. I offer what's called the Lee no scalpel technique, as I think this really has the evidence about terrifically effective for contraception. It's the lowest risk of complications, so infection, bleeding, and post-vasectomy pain syndrome. And although I counsel guys to think of vasectomy as a permanent option, if there is a change of heart down the track, it does leave the door open for vasectomy reversal, unlike some larger, older type procedures. You might read about laser vasectomy and no needle vasectomy. These are really referring to some American sort of options. The Matajet, which is a no needle, high pressure local anesthetic injection into the skin, is not actually authorised by the Therapeutic Goods Administration in Australia, and so as a result I don't use it. Now, no denying we need to inject the local anaesthetic, but chat as we go, lots of distraction, try and keep things as comfortable as possible, and really, should be no worse than a flu needle sort of jab. You want to think about experience for the doctor. I've been offering vasectomies in some form or another since 2007, but have been focused over the last 6 years more fully, and vasectomy is about a quarter of my work these days. I've currently completed 1,950 something vasectomies as of May 2026, and my complication and problem risk is really preferable when we look at the data. Comparing my practice to a large UK study of 94,000 vasectomies, they had a failure rate of 1%. Currently I've had 4 failures out of my guys, so sort of 0.3%. My rate of post-vasectomy pain syndrome is also thankfully very low at about 0.2% compared to 0.5% in their study. So currently I'm doing well and doing slightly better than some large landmark studies like that of large populations. I do the vasectomies myself. Now, very rarely we might be training another doctor here, but you would certainly know about that and could sign up that often at a reduced rate if that was the case. But if I've consulted with you and you're expecting me on the day, you're going to get me on the day. There are some vasectomy providers who fly in from Brisbane, Sydney for the day, and they run a list down here and then return to their state. Now, that does mean if you have a complication that night, the next morning, that doctor could be interstate already. So, what you see is what you get. I work here in Preston, we consult here in Preston, we do the procedures here in Preston, I live in Preston. You've got details of getting hold of me after the procedure if there's problems. You know where I am, and you know how to get hold of me, and I make that clear in the information sheet we give out after the procedure. You want to know what the consultation and the workflow sort of process looks like. So for some providers, you might not chat to the provider directly until the day of procedure. You'll watch a video or have some emails that sort of introduce you to the process and the consent process. I still prefer to chat to each guy individually before the procedure. Now, with the advent of video telehealth, that works really well, and you can just grab a quiet meeting room at work or jump in the ute at a work site and have a video consultation with me. And I really like that, a chance to talk through the procedure, answer questions you might have about vasectomy your partner has, and also talk about important risks and problems to expect and what to expect on the day. So yeah, I like to individually chat to each guy and give them that best chance to answer any questions that they might have. On the day, again, you're coming in here, you're seeing me. There's another video which talks more about the process, but you're coming in here, having a final chat. We go to the procedure room, just you and me in the procedure room 99% of the time. Coming back to my room, talking about paperwork and follow-up and getting you home. Then information sheet about aftercare, and you can definitely get hold of me if there's any concerns, problems, or complications We also use a local pathology provider, Dorovich, for the post-vasectomy sample at 3 months' time. So really trying to keep it very obvious how things work. And then I follow you up with, again, telehealth with the result in 3 months, so you don't need a separate appointment back there. You should have a look at costs and what it includes. There's no charge for that first telehealth consultation. We bulk bill that through Medicare. We ask for a $100 booking fee if you're keen to go ahead and it's the right thing for you for vasectomy, and then you're paying at the moment in May 2026, you're paying the remaining $655 on the day after the procedure. $227 is coming back to you from Medicare. You may get more back from Medicare if you've met the Medicare safety net. Because this is a smaller procedure done in the community without a general anaesthetic these days, this doesn't attract a private Medicare, health insurance rebate, but it does get that Medicare rebate. And then there's no cost if we do need either follow-up appointments because we've had a complication or something we need to review, and that follow-up test as well. Now, Dorovich, the pathology company, is charging a $50 gap. Currently, they've just changed that in this year when you drop off your sample at 3 months. But apart from that, there really shouldn't be other courses. There's no other administration costs, other sort of hidden fees there in the procedure. So a few things to think about, when you are thinking vasectomy is the right thing for you and you're looking around for a clinic in Melbourne. Always keen to touch base, discuss, answer questions. So you can use the hot doc, book online. We can have that telehealth talk. Partners are welcome to sit in for that and ask questions as well. And then we can decide if vasectomy is the right thing for you. Thanks very much for watching.